Now I'll talk about some other options, such for early stage treatment. That means this cancer is caught early and there is a chance for cure. Unfortunately, many people are not diagnosed at an early stage, but if someone has liver cancer and they're fortunate enough to be found early, they have a few more options. Surgery is usually used to try to remove all of the cancer. And then, of course, transplant is a type of surgical treatment where the liver is removed and the donor's liver is put in place. Now, I mentioned earlier in this talk that the liver is the only organ that can regenerate itself. So if someone has an early stage liver cancer and the rest of their liver is healthy enough that they can survive with part of a liver, the liver will eventually, part of it will eventually grow back. That's a good thing. But also know that whatever we do with any cancer treatment, even if it's completely removed, liver cancer can always come back. So it's always important to have continued follow-up with your doctor.
So what about early stage treatment options? We talked about surgery. When liver cancer is caught early, there is a chance for cure. Cure means that we don't think it's going to come back. But remember, anytime we treat cancer, even if we think it's cured, we still have to monitor it because there is always a risk of recurrence. So local therapy treatment is focused on a specific area, like we talked about surgery, just cutting it out. That's for people who may not have cirrhosis or who have what we call very well compensated liver disease. Their liver is functioning very well. Transplant is usually going to be what we're going to do most of the time in people who have early stage cancer, especially because these are patients that typically have cirrhosis and they're at risk of getting liver cancer again or having it in different parts of the liver where we may not see it. As we talked about, liver cancer can come back. So you always want to make sure you're continuing with close follow-up with usually, like I said, a hepatologist to make sure that it's not recurred.
The next is intermediate stage, the treatment options. People with the intermediate stage liver cancer usually cannot have surgery, but they can have other local therapies, such as ablation. This is when they may put a needle into the tumor and use extreme heat or cold or radio waves. This is something called RFA or radio frequency ablation, or when they use extreme cold, cryoablation. There's also something called chemoembolization, where an interventional radiologist will mark out and map the blood supply to the tumor and then block off the blood supply to the tumor with either stents or devices that will block the blood flow, or even put chemotherapy directly into the liver in those small areas. And then also radiation therapy can be used.
But what about this intermediary stage that I mentioned, the non-surgical local therapies? So these are local therapies that directly treat the cancer. One of which is ablation. That's where radiologists can go in with a probe and really burn the cancer, either with cold or heat, radio waves, microwaves, chemicals, and just burns the cancer. So you have to be in a very early stage for that to be an option. We do use that. More commonly, what we do is what was called radiation therapy or yttrium therapy or Y90. You may hear it called. That's where the radiologist goes into an artery and uses their catheter to go towards the cancer. They will find the cancer and they will inject it locally with radiation beads. They can also do what's called chemoembolization, where they inject the cancer locally with chemotherapy beads. So as you can imagine, this therapy can be very effective, but it's not often thought to be curative. So it can keep the cancer gone for some time, but the concern is that the cancer will come back. Because transplant is the best option, people can't be transplanted immediately when they have liver cancer. So many people have to wait 6 months to a year, if not longer, before they're transplanted for their liver cancer. So we will use these local regional therapies in the meantime to treat their cancer while we wait till they get to a curative option. So they will get ablation, chemoembolization, or radioembolization while we wait to get them to transplant. So these are kind of bridge therapies to transplant as well.
So there are treatments for advanced stage liver cancer. Unfortunately, 80% of the time someone is diagnosed with hepatocellular carcinoma, it is too advanced for local therapies. But we always have new therapies coming about for cancer at all times. As we mentioned earlier, I've been doing this for almost 30 years. We have treatments today that we didn't have even 5 years ago. So some of the options include chemotherapy. Chemotherapy is chemical therapy. Now, we don't really use chemotherapy as much anymore because we have such good targeted therapies, and now immunotherapy is available. But chemotherapy, all cells grow and cells die, and there's different parts of the cell. There's the membrane, the nucleus, the mitochondria, nucleoli, and different chemotherapy agents work on different parts of the cell. We also have targeted therapies that focus on certain parts of cancer cells as well, a little bit more specific than chemotherapy. This stops and interferes with how cancer cells grow and divide or even spread to other places. And then immunotherapy works to stimulate the body's immune system to fight off cancer. The immune system is always taking care of us. We fight off colds, flu, infections, all types of things. Cancer cells have figured out a way to hide from the immune system so the body cannot fight that off. So immunotherapy stimulates the immune system so the cancer cells can no longer hide from the body's immune system. And those are several options for advanced stage treatment of liver cancer.
There are treatment options. We consider that usually systemic therapy. Systemic therapy means that the treatment works throughout the body. And so you can imagine if there's a lot of cancer in the liver or cancer in other organs or lymph nodes, you don't want to do the local regional therapy because that only targets a small area. You want treatment that can go all over. And in fact, some studies have suggested that 80% of HCC or liver cancer is diagnosed at a stage that's too advanced for local therapies or too advanced for curative options like transplant. But developments do continue in the treatment of liver cancer that's advanced, and a lot of improvements really have been made over the last 5 years. We used to have very few options, and the options that we did have really did not result in very good outcomes. But over the last few years, with the development of immunotherapy, using the immune system to really attack cancer, our outcomes have been much better with more advanced therapies. So you can have chemotherapy, which sometimes can kill the cancer, but also kill our cells. So that can be a little bit more toxicity associated with chemotherapy. Whereas targeted therapies really target more things that the cancer is using to stay alive and to really continue. And so that means that there are less side effects for us or for the patient that's being treated. But immunotherapy really has become the new wave for cancer treatment, not just liver cancer, but also other cancers. And it's resulting in a lot better outcomes with fewer side effects in the treatment of more advanced liver cancer.
So if you've been diagnosed with liver cancer and any cancer, first of all, don't lose hope. There are many FDA-approved treatments. There are clinical trials. There are many, many options for treatment for cancer. So we always tell people, don't lose hope. And cancer does not mean it's a death sentence. It's important to find doctors that specialize in liver cancer to help you determine the best options for you. There are oncologists who specialize in liver cancer. There's a hepatologist, which is a gastroenterologist who specializes in liver diseases, and then a gastroenterologist who's a physician who specializes in diseases of the GI tract. But it's good to keep open communication and discuss these and get lots of information before you make your final decision about your treatment plan.
So if you've been diagnosed with liver cancer, don't lose hope. Even if you've been diagnosed with advanced cancer, there are FDA-approved treatments like we discussed. It's important to find a doctor that specializes in liver cancer to help you determine the best options for you. And often I see people, unfortunately, only sent to oncologists or cancer doctors or only sent to surgeons, where really the best quarterback for liver cancer is a liver specialist, because they will make sure you're getting the right options and the right treatments at the right times, especially knowing when a curative option is available or helping you get to where a curative option is available, especially making sure that transplant is on the list of options, especially if you have advanced liver disease. So certainly you can see an oncologist and you can see a gastroenterologist, but you really most likely want to be seeing a hepatologist, who is someone like myself who specializes in liver disease.